New COVID-19 cases fell today in Virginia. Still, it's too soon to know if this is the start of a new trend. Dan Kennedy takes a look at case numbers and hospitalizations and how they compare to other periods of the pandemic.
Let's start by talking about hospitalizations in Virginia today, up to 1,137. So that's basically the levels we were looking at for the entire month of March when the vaccine started to become pretty widespread and available to people. Now, after dipping a bit, Delta came back, and so have hospitalizations. Cases on the way up to 1,700 today, although it's one of the fewer reporting numbers we've seen in recent days. That 2-week moving average still driving upwards. So let's continue to talk about cases statewide in Virginia, but I'm going to zoom this out. We're going to actually look at cases dating far back as a year ago. So this is August of 2020. You saw things really started to take off back in November, December, January. Then the vaccine became available, and then you saw cases started to plummet. And then for the most part, back in June, we were having a good month. Then Delta came back, and we find ourselves now at the same levels we saw back in March and at the same level we saw back in November, around Thanksgiving of last year, before things really took off in the wintertime. But keep in mind, the majority of cases going around right now are in unvaccinated people. 98% of the cases estimated by the Virginia Department of Health. Taking a look at some of our local cities, this is Virginia Beach, below the 2-week moving average today for the first time in about a week, but still 120 cases to report there. Newport News above average today with 78 new infections. In the studio, Dan Kennedy, 13 News Now.